A recent I-Team Tampa Bay Times investigation revealed outrageous fees charged to trauma patients at some Florida hospitals. Now, one Florida lawmaker is saying he's willing to take action to bring them down. Investigator Adam Walser has the latest.
Just to walk in the trauma door, they charge us $33,000.
It's a terrifying reality for Florida trauma patients.
One accident, one injury, one tragedy, it can change everything in a second.
Enormous bills that start adding up the second they arrive at the hospital.
Sometimes they just see you as a dollar sign, and I just think that's sad.
The I-Team, in partnership with the Tampa Bay Times, exposed these high costs in a first-of-its-kind investigation earlier this month.
A lot of your stories and a lot of that information kind of permeated over the last couple of weeks.
State Representative Greg Stubbe credits the investigation with making lawmakers aware of some of the huge costs their constituents are paying. Those fees, which are intended to pay for such things as specialized equipment, on-call pay, and advanced training, have risen rapidly in recent years, especially at Florida's 6 new trauma centers owned by Hospital Corporation of America. There, the average fee is $27,000, 4.5 times as much as at non-HCA hospitals.
Obviously, that is not equitable to consumers who are not really having an option of where they're going to be transported to, especially in a trauma situation.
Stubbe's district includes Blake Regional Medical Center, an HCA-owned hospital with the 3rd highest trauma response fee in the state at more than $29,000. But Stubbe has co-sponsored a bill that would allow Blake and 2 other HCA hospitals to continue operating trauma centers, despite lawsuits aimed at shutting them down.
I look at it as we need to ensure that our citizens, both in my district and in the state, have adequate and quick access to trauma centers in the state. I personally don't care who owns them.
Stubbe believes the high trauma response fees will be addressed within the next few weeks, either by the Board of Health or through the legislature. But is he prepared to change his bill to deal with these high costs?
Yeah, I would look at doing that in the trauma centers bill that we have moving through the legislature this year.
We reached out to all the legislators on the subcommittee that voted on that bill last week. Bill sponsor Jason Broader was the only other representative to reply. He said he looked forward to researching the issue of trauma cost further. I'm I-Team investigator Adam Walser, taking action for you.